Hi, my name is Sarah McLeod. I'm your host for Proven Cures, and today is Tuesday, April 30th, 2019. This video is actually a special dedication to my dear friend, Shaili Rasania-Gurala. This video is just for you, my girl, and for anyone tuned in who has experienced the debilitating symptoms of endometriosis, or someone dear to you has gone through various treatments and has not had any true relief for endometriosis pain and accompanying symptoms. You have tuned into the right station. I hope the glare in my glasses isn't bothering you too much. It's not too much I can actually do about it. I see it and it's actually irritating me, but I'm going to try and keep this as short as possible without leaving out important information. So the title of the study that I'm going to cover today, so you can see for yourself, that's the study. It's titled Effect of French Maritime Pine Bark Extract on Endometriosis as Compared with Leuprorelin Acetate. Now, Leuprorelin Acetate is actually a class of drugs known as GnRHAs, or gonadotropin-releasing hormone agonists. And it is a class of drugs that is normally given to treat the pain associated with endometriosis. Okay? And that is one common treatment. Another common treatment is danazol, which is a testosterone derivative given to patients who have endometriosis in order to decrease their estrogen levels. And because of that, these women often suffer from hot flashes. They get osteoporosis early in life, systemic malaise, feeling tired, fatigued, and even obesity as a result of having to take this testosterone derivative. And the only other treatment that I found that is commonly available is surgery. Now you're probably thinking to yourself, why would I have to have surgery if I have endometriosis? Well, endometriosis is in fact the development of the lining of the uterus outside of the uterus. So endometrium is found sometimes in the ovaries, the oviduct, and a part of a woman's reproductive system known as the pouch of Douglas. And when the endometrial lining is misplaced like that, it causes inflammation, which manifests as severe pain in the lower abdomen. And not just when a woman's on her period, it can happen during sex and at other times. The disease, unfortunately, is most prevalent in women who are ages 18 to 42, so during the childbearing years, and it can affect fertility as well. As a woman gets older and approaches menopause, the estrogen levels go down, and that is the time they normally get relief from endometriosis. So, the Leuprorelin Acetate, as I explained, is a gonadotropin-releasing hormone agonist, and it was given because it's a regular treatment. It was given in comparison to, and this is where you get your pens out. I want you to write this down because I might mispronounce it over the course of this video. They gave the Leuprorelin in comparison to something known generically as pycnogenol. So that's P as in Peter, Y, C as in cat, N as in Nancy, O, G as in gate, E, N as in Nancy, O, L as in lady, pycnogenol. And it was given, so let me tell you, before I tell you how much they were taking and everything, the study is actually published in the Journal of Reproductive Medicine. And the publishers are Drs. Takafumi Kohama, Dr. Kotaro Hirai, and Dr. Masaki Inoue. The study was conducted in Japan, okay? And the researchers recruited 58 women to be a part of the study. 32 of those women were given pycnogenol at 30 milligrams twice a day for 48 weeks, so that's almost a year. And the other 26 women were given the therapy that I'd mentioned earlier, the GnRHA therapy. Now, the reason why they were followed for so long was to really see about side effects and to see if the pain would, not even if the pain would recur, but how soon it would recur. And their what they found was absolutely shocking. So in the group that received the Leuprorelin Acetate, 5 women had to stop due to the fatigue. 1 stopped due to massive bleeding. And after 24 weeks, because they were followed at the 4th week of therapy, 12th week of therapy, 24th week, and 48th week. After the 24th week, the pain actually returned. The same level of pain that they started with returned after 24 weeks of treatment with the GnRHA. So how did it turn out for the people who were given the pycnogenol? None of them left due to side effects. The side effects that were reported were acne and increased bleeding. However, the pain reduced significantly every time at 4 weeks, 12 weeks, 24, and 48 weeks. The menstrual pain decreased, the pelvic pain decreased, the pelvic tenderness decreased, and something called pelvic induration also decreased. And the significance of this is that the study was able to prove that at 30 milligrams twice per day over the course of 48 weeks, pycnogenol is able to provide long-term treatment for the symptoms of endometriosis. So I hope this is helpful for you. If you are a sufferer, I would say, hey, why not give this a try? It does not affect your estrogen levels at all. All women in this study were tested for that, and whereas the GnRHA drug definitely lowered estrogen, the pycnogenol absolutely did not. It also had a positive effect on a blood biomarker known as CA-125, which is existent in cysts that are associated with endometriosis. So that biomarker actually went down, which is indicative of the cysts decreasing in the body, because that's what those cysts are full of, that biomarker. So I hope that you find this helpful. Please subscribe to my channel and make sure to hit the bell thingy at the end so that you will be notified of subsequent videos that I have coming along. And I'm very open to what you have to say. I answer questions sometimes at my Gmail, provencures@gmail.com. Sometimes I get so busy and bogged down, and I have a big saved folder of the emails that I haven't gotten back to. Even one of my subscribers, I hope you're still a subscriber, I believe back in February, was telling me about another study on an HIV medication that they wanted me to read through and share. And I've been so busy, but I have not forgotten. And because I have not forgotten means that I'm definitely going to get to it. Just be patient with me. And thanks for tuning in, and like, share, subscribe. Thank you. Have a good one.